1 out of 5 women in India suffer from polycystic ovary syndrome. PCOS affects millions of women of reproductive age in India and is the leading cause of infertility. Hi, I'm Sania Mirza, and I take privilege to welcome Dr. Jasleen, a renowned health expert who will offer practical strategies to empower women in managing PCOS complications. Raising awareness about PCOS can greatly benefit women due to the numerous myths and misconceptions surrounding the condition. Doctor, can you enlighten us on how a balanced portion control meal can positively impact a PCOS patient?
Thank you for the question, Sania. We do know that about 40 to 80% of women with PCO are either overweight or obese. And these days, there seems to be a pandemic of overweight PCOS patients coming to our clinics. We have seen that dietary restrictions play a major role and are the cornerstone of management of PCOS in these patients. We advise our patients to have portion control. We tell them to take a balanced diet in the right quantities. The carbohydrates should constitute not more than 40% of your total dietary intake of the day. Protein levels should be maintained and should be 30% of your dietary intake. Fats should not exceed 20% of your dietary intake. If required, you should be in a calorie deficit. Complex carbohydrates should make up most of your carbohydrate intake of the day. Simple carbohydrates and processed food and junk food should be avoided under all circumstances. So we have seen that patients who follow instructions and follow a balanced diet and portion control, also patients who keep a food diary, they are the ones most likely to achieve their weight goals and control their PCOS.
Thanks, doctor. Can you also share how crucial is physical activity in the management of PCOS?
That is a very relevant and apt question coming from you, Sania. So physical workouts and weight reduction, this is the second cornerstone of PCOS management. So studies have shown that loss of body weight, up to 5% of the body weight of the patient, can improve all the metabolic dysfunctions of PCOS and improve fertility in those who are suffering from infertility in the patients of PCOS. So, Sania, you are a player yourself. You know the importance of physical activity in the life of a person. But for a lay person, it is very difficult to understand this importance. And this we try to teach all our patients. We recommend about 150 minutes of exercise every single week. This includes moderate aerobic exercise where the heartbeat is raised to a certain limit. And we have seen better results in all our infertility patients, in those who follow instructions and lose weight by 5% of their body weight minimum.
Thanks, doctor. One more question. What are the important parameters to be regularly monitored in PCOS patients?
See, monitoring of patients with PCOS is very important because we have seen that PCOS is a chronic condition which can start from as early as the teens and go up to as even longer than the menopause and have its consequences in the body even then. So monitoring is important because PCOS is not just abnormal periods. It can lead to infertility. It can lead to a high risk of diabetes, hypercholesterolemia, and uterine cancers. So monitoring is very important. We have already discussed your meals and your movement, and the third end is monitoring. So monitoring includes body mass index at every visit, fasting blood glucose and blood pressure. And then if the person wants to conceive or is a patient of infertility, we need to do ovulation studies and treat accordingly. In pregnancy, these women are at high risk of gestational diabetes, and in that case, we can monitor with an oral glucose tolerance test done at the first visit and repeated if required. In later life, and even in obese patients earlier, we need to check their cholesterol levels regularly and, like I said, blood pressure, and also monitor them for uterine cancers. as we have seen that there is a higher incidence of uterine cancers in patients with PCO.
Doctor, the clear message for all women is that meal, movement and monitoring are pivotal in managing PCOS for the benefit of women and society at large. Thank you, Dr. Jasleen, for your valuable insights which can be vital for effective management of PCOS. As an athlete myself, I recognize the importance of lifestyle management for a healthier tomorrow. Together, we can break the stigma, spread awareness, and support each other in this journey towards better health and well-being.